Hello students, welcome to Pharma Syndrome YouTube channel. And today our discussion is on beta blockers. So in sympathetic nervous system, you studied sympathomimetics as well as sympatholytics. So in the category of sympatholytics, there is a category of sympatholytics. So one is alpha receptor blocker and another one is beta receptor blocker. For alpha receptor blockers, already we made a video, so you can watch in our channel Pharma Syndrome YouTube. Pharma Syndrome YouTube channel, and you can follow our Instagram page also. It is also having same name, Pharma Syndrome. Okay, anyway, let's go into the discussion. And let's beta blockers. So beta blockers are nothing but they oppose the action of sympathetic nervous system by blocking the beta receptors. So the neurotransmitters in the sympathetic nervous system are adrenaline, noradrenaline, dopamine. So especially these neurotransmitters action can be blocked by using beta blockers. Especially these drugs blocks the sympathetic nervous system action on the beta receptors. The name itself indicating these drugs beta receptors. These drugs blocks beta receptors. So generally there are three types of beta receptors: beta 1, beta 2, beta 3. All beta receptors are belongs to the G protein coupled receptors. So anyway, enter into the topic. Beta blockers oppose the actions of sympathomimetics on beta receptors. So the classification of beta receptors is divided into three generations: first generation, second generation, and third generation. The first generation beta blockers are categorized as a non-selective beta blockers. These beta blockers may act on the beta 1 receptors, may act on the beta 2 receptors. Generally, beta blockers are primary indication. They're primarily useful. When you strike beta blockers in your mind, you think that, okay, these drugs are for useful for hypertension. Why? Because excess beta receptor action is leads to the hypertension. That's why to control hypertension as well as to control other serious disorders, we have to take beta blockers. So regarding classification, the first generation beta blockers are called as non-selective beta blockers. They are non-selective beta blockers. So here there are number of examples in the first generation, nothing but non-selective beta blocker. The simple mnemonic you have to remember is protein pills. The general spelling of is protein pills. For our mnemonic purpose, this is protein pills. PRO means propranolol, TI means timolol, N means nadolol, PI means pindolol, again L means levobunolol, and S means sotalol. All these drugs you can remember is by mnemonic protein pills. The protein pills are comes under first generation non-selective beta blockers. Okay. After first generation, next one is second generation. So the second generation category of beta blockers are called as a selective beta 1 receptor blocker. So before selective, already the drugs are introduced as non-selective. So there is some side effects, some problem with non-selective. So if you want to block only beta 1 receptor, you require selective beta 1 blocker. For that purpose, the scientist made some changes in the drugs and confirmed as a nothing but they selected as a beta 1 selective receptor blockers. So the mnemonic for beta 1 selective receptor blocker is EMBA. So what are the drugs under this category? First E is esmolol, next is metoprolol, next B is bisoprolol, next A is etanolol, again A is acebutolol. All these five drugs are comes under the second generation, that is selective beta 1 receptor blockers. And next is third generation. Next is third generation. So here regarding third generation, there are two category of drugs are there. In the third generation, again there are two category. First one is mixed alpha plus beta receptor blockers. So these drugs can block alpha receptors and these drugs can block beta receptors. And another category, vasodilators with beta 1 selective action. So in this category, these drugs are having vasodilation action. Along with these drugs also blocking beta 1 receptors. Regarding mixed alpha plus beta blocker, you can remember as a CAR lab, that is carvedilol as well as labetalol. Carlab, carbidopa as well as labetalol. Labetalol is a drug especially used in pregnancy to control hypertension. Labetalol, labor means during nothing but pregnancy, delivery of a baby, labor. So you can remember labetalol, labor. Labetalol is used for to control hypertension in the pregnant woman. And here vasodilators with beta 1 selective action. The mnemonic is CBN. CBN. Example, celiprolol, betaxolol, nebivolol. So CBN means Chandrababu Naidu. So Chandrababu Naidu is nothing but he's a ex-CM of the Andhra Pradesh. So celiprolol, betaxolol as well as nebivolol. So this is a simple classification of a beta blockers. This is a simple classification of beta blockers. So here beta blockers are classified into 3 generations. Beta blockers are classified into the 3 generations. So first generation are non-selective, second generation are selective, third generation are having again 2 categories, that is alpha plus beta mixed action as well as vasodilation action with the selective beta 1 receptor action. So again, one important point is here, nebivolol. Nebivolol comes under the third generation category. The dextro isomer of the nebivolol blocks beta 1 receptors on the heart, and the L isomer of the nebivolol stimulates the endothelium nitric oxide function. I hope you know nitric oxide. Nitric oxide is a gaseous neurotransmitter. So this is NO means nitric oxide. It is a gaseous neurotransmitter which is a potent vasodilator in the body. It releases from the endothelium. Endothelium is a lining layer of the blood vessel. When endothelium releases nitric oxide, it causes vasodilation. That's why nitric oxide is also called as endothelium derived relaxin factor, EDRF. E means elephant, D means donkey, R means R means what we can, R means right, 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 and F means fellow. So like that. So EDRF, endothelium derived relaxin factor, is under name of nitric oxide, which cause vasodilation. So this is regarding a simple classification of the beta blockers. I hope based on this mnemonics you can easily remember the drugs, and it is helpful for you. Thank you.